everyone, I'm Mila, I'm a type 1 diabetic, and today I want to talk about how skin can be affected by diabetes. And then what steps people who have diabetes should be taking to protect their skin, and different things that people with diabetes are more at risk for with concerning their skin. This is just general skin stuff. I'll probably do a video later about how important foot care can be, because that's also something important for diabetics. So be on the lookout for that. Before we get started, I felt like a change. I wanted to not sit in the same place that I always do when I film at school, and show off a little bit more of my room and show that it's not just white. Surprise, surprise. I like color. I just kind of didn't feel like sitting in front of the same set all the time. But yeah, this is a different corner of my room. I hope you like it. So I am by no means a skincare expert. However, these are things that I found online that they say should help. And so I kind of wanted to try them out. And I invite you to try them out with me, because they won't hurt your skin if you're not diabetic. Then again, you also know your skin well, and if something's not working for you, obviously don't do it. Don't keep doing it. So let's get into the video. So skincare has kind of become an industry, now more so than when I was younger. When I was younger, I remember hearing conversation or hearing ads saying get rid of wrinkles, but there weren't as many brands for skincare stuff as there are now. And it's super trendy to talk about, oh, well, I'm doing this for my skin, and I love doing face masks and sheet masks and mud masks and all these other things. It's become an industry, which is kind of why I want to talk about it, because diabetes does affect your skin, and there are some things that you should keep in mind when you are taking care of your skin. So one of the things diabetes does to skin is it makes it drier, and that makes it a lot easier for people to get injuries, and for those injuries to get infected. Cuts and scrapes are a lot easier to do to skin that's dry, and then if you don't take care of it properly, it's easier for it to get infected. There's also a condition called diabetic neuropathy, which I'll probably talk about later. But that makes it easier for diabetics to not really have full feeling in the lower extremities, which is why foot care is so important, but foot care later. And blood flow being affected by diabetes obviously makes the wounds heal less quickly. So that's something to keep in mind. There are different bacterial infections that are more common in diabetics. Those are styes, so the little sometimes you get pain in your eyelid, and it's not something is in your there's something in your eye, but you can't see what it is sometimes, or it just hurts. That's a little infection in your eyelid. That's called a stye. Those are more common with diabetics. Boils are more common. Folliculitis, which is hair follicle infections. Carbuncles, I think. I'll put the word on screen. I think it's pronounced carbuncles. Those are deep infections of the skin and then tissues just under them, or just under the layer of skin. And then a lot of infections around your nails. So watch out for your nails. Nail care is also important. Diabetics will get bacterial infections like those that I just mentioned, more than people who don't have diabetes. However, some doctors say that you can reduce your risk of those infections with good skincare habits. And before we get to those habits, I'm going to talk a little bit about common and less common conditions that diabetics are more prone to than people without diabetes. So there are, ooh, I scrolled too far. First things, like I have several like layers of things. The first is just broad fungal infections. There are 4 that are fairly common: jock itch, athlete's foot, ringworm, which is like a round itchy, you can't see my arm, it's like a round itchy patch of skin, and yeast infections. Those are more common in diabetics, but obviously not exclusive to them. Itching is another thing that diabetics are more at risk for. Those can be caused by yeast infections, poor circulation, or dry skin, all of which, as I've just mentioned, diabetics are more at risk for. So when you have poor circulation that is causing the itching, it's more likely localized to your lower legs. So keep that in mind if you are diabetic. And then there are some more specific diabetes-related skin conditions, and I have a very long list of them that I would probably not pronounce correctly, so I will try to put the words on the screen because I am bad at pronouncing things, and I can definitely type in a little text box on the screen to like show you how to spell it, so you can look it up. There's Acanthosnigricans. I don't know. The word is on the screen. This one scares me a little bit. This condition is like it appears as tan or brown raised areas on the skin, primarily in the neck, armpits, and groin. But sometimes they can also happen on your hands, elbows, and knees. Typically, this happens when someone's extremely overweight. And the best solution is weight loss. But there are some creams that can like help them look less, help them look better. The next is diabetic neuropathy, which presents as light brown scaly patches, oval or circular in shape, and they most often, hold on, I'm reading from my notes. So these ovals or circles usually happen on the fronts of legs, but they don't hurt or itch or open up. They're caused by like little changes in the capillaries under your skin that are caused by diabetes. Necrobiosis lipotica diabeticorum. It's the same cause as diabetic dermopathy. This condition often starts as a dull red raised area, and after a while it can look like a shiny scar with a violet border. The blood vessels under the skin become easier to see, and sometimes the spots are itchy and painful. Sometimes the spots can crack open too, which does not sound good to me. It's a rare condition, so you probably won't have it, but adult women who have diabetes are more likely to get it, and if those sores open up, you need to go get treatment from a doctor. I would say if you notice those, go to a doctor anyway, let them know what's up, and they can like help you, because that it doesn't sound very pleasant to have. So allergic reactions are also on this list. You can have skin reactions to injection sites or to diabetic pills, which I think are something that type 2 diabetics can take, but type 1 diabetics can't. Look for rashes, depressions, or bumps at the injection site to like determine if you're having an allergic reaction to your insulin. And then tell your doctor as soon as you think you're reacting to a medication. That should just be, standard procedure. Like if you notice that you're like reacting to something that you're taking, tell your doctor, and they can figure something else out for you to take. Next on my list is diabetic blisters. You can apparently, if you're diabetic, erupt in blisters on your extremities. So feet, hands, legs, and arms. They look like burn blisters, and they're more common if you have diabetic neuropathy. They're painless, they have no redness around them, and they heal themselves without scars, so that's good. And they can heal themselves within 3 weeks. That sounds like it would take forever to get used to or to like deal with. And the treatment is just to bring your blood sugar levels back into an appropriate range. So apparently, having a high blood sugar can cause you to, quote, erupt in blisters. That's the wording that the website used. And this is from the American Diabetes Association. So that's a lot. Another condition is eruptive xanthomatosis. Again, hopefully I'm still putting all of these on the screen because these are long words that are hard to pronounce. This is also caused by uncontrolled sugars, and so they look like firm yellow pea-like enlargements on your skin. So like goosebumps, but bigger and yellow and firm. Each bump has a red halo around it, and it could itch. This condition is usually on the back of your hands, on your feet, arms, legs, and on your buttocks. And then this is more common with young men with type 1 diabetes. So if you're a younger dude, you might want to look out for this if you have type 1. And just control your sugars and you should be fine. The next condition on my list is digital sclerosis. You'll develop tight, thick, waxy skin on the back of your hands. Sometimes the skin on your toes and forehead also become thick, and your finger joints become stiff and won't work properly anymore. Occasionally, but rarely, knees, ankles, and elbows can also get stiff. This happens apparently in about a third of all people with type 1 diabetics, and your treatment is to make sure that your blood sugars are in range. That seems to be the treatment for a lot of these things. That's a little, curious to me. The last one on my list, and then I'll get into skincare habits, is, disseminated granuloma annulare. Again, you can see how it's spelled on screen. This is a sharply defined ring or arc-shaped area on your skin. These are rashes that occur most often on your fingers or on your ears. But sometimes these areas can occur on your torso, like the part of your body that's called the trunk. So not your arms, your legs, or your neck and head. They can be red, brown, or skin colored, and this is treatable with medications. They didn't really have more information than that, I guess. So this next list is good skincare habits. This is also from the American Diabetes Association, and also WebMD, just to supplement. I know a lot of people don't really trust WebMD, but I feel like if it's supporting the American Diabetes Association and there's not that much a difference between the information, it's fairly reliable. So this is a list of good skincare habits. Let's go. First things first, keep your blood sugars in check. A lot of the conditions I've already listed. So to treat the condition to get your blood sugars in check. So keep your blood sugars in check. Higher blood sugar values can lead to drier skin, which can lead to a lesser ability for you to fight off bacterial infections within cuts. And as I've already mentioned, it can also lead to you getting those other conditions. Use lip balm to avoid chapped lips. I know recently my lips have been so chapped, and so I've been drinking water and putting on chapstick like mad. Keep yourself covered up when it's cold or windy. Outside, make sure to cover your ears, face, wear a hat, gloves, keep warm boots when you go outside when it's cold and windy, or just cold or just windy. You don't want to, get unnecessarily cold or have your skin exposed to harsh conditions. Don't take super long showers. I know that one can be hard. I really like long showers. They also say don't take extremely hot baths or showers. The heat feels nice, but it can also dry out your skin. So don't do anything that's too hot. In general, keep your skin clean and dry. If you go out in the rainstorm, don't stay in wet clothing. Try to dry off if you get soaked in a torrential downpour or whatever. If your skin is already dry, don't use bubble baths. And then when you get out of the bath or shower, put moisturizer on. Use moisturizing body washes, things like that. Don't put lotion between your toes because fungal, like you can increase the chance of a fungus growing there and you don't want that. Pat your skin dry, don't rub it. That's also really hard for me to remember to do. So if you have itchy skin, don't itch it. Keep your skin moisturized, especially when it's cold. Treat cuts right away. Wash cuts with like soap and water. And then if you use like antibiotic creams, feel free to use those. Cover it with sterile gauze or a Band-Aid. And then if you have a major cut, burn, or infection, go see a doctor. Obviously, that should be the way everyone treats major cuts, burns, or infections. You might want to use a humidifier and bathe less in cold and dry months. It just might be easier on your skin. And that's if you can. If you can't, there are other ways to like do things like that. So no worries. Use mild shampoos, so not something super chemically and harsh. Take very, very good care of your feet. I will do a video about that later. And then limit the number of skincare products you have so that if you have a reaction to one of them, you can figure out which one easier. And then if there are skin issues that you can't resolve by like not use, so like say you have like a skincare thing that you have and it like breaks you out. Like if you stop using that skincare thing and you don't see like, and you can't like figure out like what's causing it, or you like can't fix the skin issue, go see a doctor. Okay, so that's everything I had for you guys today. Thank you so much for watching. If you would like to learn more about diabetes from a patient perspective, please subscribe below. Like and comment if you liked the video or wanted to say hello. I don't know. Whatever you want to do. I will see you all in a couple of weeks. Stay healthy. Bye.